Okay, Ted, did you want to go ahead and get started?
Yes. I talked a little bit about the mentoring table at the AROHE conference, and we've heard about TIAA craft. I think everybody who attended got something out of it, and I think we'll just do the same thing again with the raising of hands to talk about that. Well, I can say that one thing that really caught my interest that hasn't been mentioned yet, Dorothy Zinsmeister, when we had our AROHE table, brought up that I think you said, Dorothy, that 10% of the attendees at AROHE were from Georgia Hero, institutions that are involved in Georgia Hero. And that's just another example of the importance and the vitality of consortia, like I think Dennis was talking about a minute ago, and that struck me.
Ted, I will, may I add something to that?
Go ahead.
Dennis added some data to the AROHE website, or sent something in, and so I went and looked at those documents that he used or that he had gathered, and apparently there were a total of 216 attendees to the AROHE conference, and 33 of them were from Georgia, and that is equivalent to 15% from Georgia Hero institutions. Georgia Hero, at least my last count, was that we have 11 institutions in Georgia that are members of AROHE. And I think one of our goals is to encourage other Georgia institutions to become acquainted with AROHE and see some of the things that they do. And of those 11 Georgia institutions, obviously Emory was well represented. And a total of 7 of those 11 attended the AROHE conference. So we had a good turnout. One of the things that Dave Ewert, is Dave on this call?
He was earlier, Dorothy.
Oh, okay. Well, one of the things that Dave always talked about, was the value of consortia, and how they can be any kind of grouping you want them to be. You can have 2 institutions, you can have 3, you can have 5, you can have a region. I remember I used to belong to the Southeast Developmental Biology organization. They can be in a city, they can be in a state, they can be community colleges, they can be R1 universities, any kind of consortium. Apparently, from what I can gather from AROHE, our consortium, Georgia Hero, may be the only one that requires membership in AROHE. And Gray, you may know more about that than I do.
I think that's right. I'm not sure.
Yeah. But we thought that was a good strategy to get more people involved in AROHE and benefit from it, and also Georgia Hero. So that's what I'm going to say. And nobody punched me in the nose, I want you to know. There's a little surgical procedure that was done, and I'm recovering with a very small black eye.
Glad to hear that you're on the mend, Dorothy. I want to follow up on the importance of consortia. I referred to this earlier. I really came out of the AROHE conference convinced that regional consortia really are the vital intermediary between having a large national organization, which has expertise but is remote, and the campus retirement organizations that are on the scene, but don't always have the resources or the expertise that might be needed. And I really see the regional consortia, Georgia, California, Ohio, and the like, as filling a really vital role in the structure of retirement organizations. And I think that Georgia Hero can be really, really important in this regard. And again, I'd like to suggest that one of the things that we commit to as an organization is in fact helping to develop retirement organizations on each and every campus in the state of Georgia. Otherwise, retirees are at an institution that doesn't have a retirement organization, and they're adrift. They're not plugged in. They don't know what's going on. And so I think it really behooves us to make sure that we can spread the good work that Georgia Hero does by ensuring that there's a retirement organization for every retiree in higher education in Georgia.
Is someone calling on us at some point?
Gray, you're muted.
Yeah, Mary Lynn,
Okay,
raised your hand
I've had my hand up because I was going to comment on Dennis's first comments about the importance of consortia. And I was excited to see that the Jesuits got together this year. And I thought that was really, really interesting. They have a lot in common. They do certain things that other schools don't do. And they seem to be very excited about their consortium and having a good, in fact, I was interested enough that I looked up Methodist universities just for the heck of it. And I was astounded because Emory's a Methodist-based university. And I had no idea that Duke was too. I mean, maybe everybody knows that. I didn't know that. But there you are. And so you can reach out any way you want. And I have got it, the drum I keep beating, and I am, look at me, I'm the wrong person to be beating it, but I want the HBCUs, especially in Atlanta and in Georgia. I tried to reach out to as best I could when we had the meeting here in Atlanta, but I would love to find, and there's the woman from Mississippi, I've forgotten her name, I've written it down someplace, but she's very interested in getting the HBCUs together, and I need to send her the list that I made. I made a list of the emails of all the provosts or administration people and sent them a copy of the program of the proposal for the AROHE meeting when we had it in Atlanta. But I think there's room for outreach there too. And those are the two that I thought of. And somebody else, there's another one, maybe it was another state that got together this year, but there's no reason it can't be across several states. You know, there's the South Central states or the so-and-so or what have you. That would be fine too. But I'm with you, Dennis. It's got to be consortia.
If I could just piggyback on that, and Gray, who's recently been to an AROHE board meeting where they're beginning to plan for next year's conference, can confirm. But yes, the woman Mary Lynn just made reference to is also on the board. The AROHE board has
Emma Ward is her name. Emma Ward.
Emma Ward, that's right, Emma Ward. And and others on the AROHE board have been very interested in reaching out to HBCUs and other institutions that might come into consortia, whether they're regional or not, right? Like the Jesuit institutions were that, you know, and that's fine. You know, maybe the way to go, if we can't pull our local HBCUs into our organization, is for a consortium of HBCUs or of community colleges or small liberal arts colleges or, you know, whatever it might be. But yes, I think having an organization in between, as Dennis was saying, in between the very local, our individual own, and AROHE, off there in California, is something to work on.
Yeah, I just want to make a comment in relation to what Dennis said. And there is a difficulty in that there's some schools that are too small to have a functioning retirement organization. And Agnes Scott is one of those. And so what actually we've done at the Emory Emeritus College is to welcome their retired faculty into our organization. And so there are a number who have joined, because the problem is there are just not enough retired Agnes Scott faculty to form an organization of their own. There's not a critical mass. And so that, I think that needs to be regarded as an alternative if some of our schools are in areas where there are other schools that might be appropriate but are relatively small. Including them in our own organization is another way of facilitating a retirement organization for schools that are just too small to have a critical mass of people.
That's very good, Gray. That sounds like a best practices report that we could bring about, just drawing the circle bigger, just draw our own, bring them in. Good idea.
And I noticed Joyce Swafford has her hand up.
Yes, she's been patient.
I'm very patient. I just want to know, does Fort Valley State College, does it have a retiree organization? Does anybody know? Question really is for Dennis. Dennis, do you know?
It does not. It does not have a retiree organization. It has somebody, it has a person who is designated as a retiree to be on the council, but there is no functioning organization at the institution.
Okay, is it one of those too small colleges not to have one? I'm just curious.
It is not.
I'm not sure that too small is really an issue. Even if you only have 10 retirees at an institution, if they get together for coffee, that is your de facto retiree organization. And we need to find at least one retiree on each campus and pull them into the network. The USG Retirees Council is trying to do that for the university system institutions. Dorothy has been really good about following up and trying to get each of the institutions to have representation at each of our biannual meetings. And she has had help from the system office because if the system office calls up a provost, that has more of an impact than if we call up a retiree. So that has had some success, but we really do have to keep at that. We don't have all of the institutions, even in the university system yet.
My reason for asking, because our new president at Clayton State came from Fort Valley, and Debbie and I have been chatting back and forth how we could use him to help us put some leverage on the HR department and on, different departments and having some of these retiree seminars. And I just wondered if he'd had any exposure experience with a retiree organization at his other college, but no. So he's fresh and we can work on him.
Yeah, and any way that we can reach out to build those contacts, build those networks, that would be helpful.
I would like to make just one little comment. I don't know if it's my turn or not. I didn't raise my hand. But several years ago, there was an article in the Chronicle of Higher Education that talked about faculty in different stages of their career. And they talked about the assistant professors who were working towards tenure. They talked about the associate professors sort of in the middle and alluded to them as sort of the forgotten group. Nobody fools around with them very much. and then the full professors at the end. And the article talked about actual institutions that had programs at the institution for retirement, for pre-retirement, getting people into a planned program over 5 or 6 years that allows them to phase out of the institution and retire. And that interested me a little bit because it sounded to me like if you decided that you were going to retire, that other people all around you were doing the same thing, and it wasn't going to be something that people begin to discount you as opposed to making contributions. But I don't know of any institutions in our state that have talked about that. So what do you think?
I do know that Florida had such a program, and California also.
The entire state of California?
I believe so.
Oh,
I'm not sure.
well, we work to the bitter end and then walk out the door. And if they have something for us to do, and we want to come back, they sometimes welcome you and sometimes they don't.
Howard has his hand up.
Yes. You asking questions about Fort Valley. I will take it upon myself to reach out. I personally know the president and the new provost. They were both at Georgia College before they went to Fort Valley, and I served with both of them for a number of years. So I'll personally sort of reach out and sort of see what I can do in that area.
Thank you very much.
I'm a newbie, so I'm asking a question out of inexperience. Do we have sort of like a speakers bureau where we can send an individual or individuals to these schools that don't have retirement organizations to talk about retirement and maybe stimulate the schools to develop something?
Dave Ewart set that up a number of years ago, and a number of us volunteered to be available to visit other institutions. I don't know how active that currently is. Gray?
I don't know.
Do we actively, so we don't actively promote that program? That may be one way in which we can make contact.
Yeah, I have done it for a number of institutions. I went over to Bainbridge College and talked with the faculty and retirees there. And I've done it for some others.
This is Dave. Can you hear me, Dennis?
Yes.
Yeah, I went to Columbus State. We put it out there. We've been underwhelmed at people following through. So it's more the promotion of getting the requests in. We have more than enough talent to talk about it.
Yeah, Dave spoke at Columbus, and as a result of that, Columbus now has a very active retirement organization. Dutchie's on the call, I think. And George Stanton was instrumental in helping that get started. And I know at one point I talked at Georgia College and State University, and they now have a active retirement organization.
I would agree we need to do more. And I think with Zoom, we could set up something, a small group of people, and figure out how to market what we can bring to people and get some of the enthusiasm going locally. But I like Howard's comment very much of starting starting with some of the worker bees, but bringing in the top level. And that's what worked at Columbus State. We got the top level in,
Right.
as well as having the groundwork done.
Yeah, this is Gretchen. I'm not sure what most institutions are doing now by way of faculty meetings, whether those are being conducted primarily by Zoom. But I too like the idea of promoting the opportunities, that retirement organizations and the statewide system especially offer, seeking out, asking people on various faculties, is there some way we could get 10 minutes of time in your next faculty meeting just to talk about the retirement organizations that we've got going and what you might be able to do yourselves, and or if you'd like to become associate members, of a nearby organization, that would be fine, something like that. As Gray has said, we've picked up a lot of members from Agnes Scott. I think promotion, that's a good idea.
Gretchen, let me extend it. I've tried 2 private schools where I had contacts, and it's amazing that the private schools in Georgia, where private schools are so important in AROHE, that we haven't figured out how to crack the nut with them either. So if we do set up something to attack the problem, we can be very inclusive in the schools to consider.
I agree, Dave, and I don't think it's, Gray was suggesting maybe size had something to do with it, that so many of the fine private schools are small schools.
Yes.
Yeah, there are plenty of organizations in the country, retirement organizations at small schools that are thriving. So somehow it's not, lack of critical mass. It's something else. Maybe the very fact that the Emory programming's been so available to the Agnes Scott people, even before Zoom came along, means they don't feel the need to get programming of their own going. I don't know.
Can I mention that I think, yes, you can go out and go to other schools, but I think maybe the Agnes Scott model of inviting that school to come be part of a successful program is another way to do it, is to draw the circle out. And after a while, they'll say, one would hope, gee, we could do this ourselves, or we've got talent. I know some people, and tell them, if you have faculty that want to do one of the colloquia for us, we'd be happy to have them, and start reaching out that way, and maybe even bring in yet another small school until they are as a core number. It's just interest. It's being flexible and finding what will work for them. And that's why I think it's so important to have just the smaller schools or smaller schools, different individual schools reach out to other ones. I mean, if we're all in Georgia, we can all be Georgia Hero. Also, somebody mentioned California. Remember when we were in Seattle, the University of California system had taken in all the information about retired faculty, how many publications they had, how much grant money they had, and they called it what would they call it, the 9th campus?
It was the 11th campus.
11th campus. There you go. That was very cool, talking about how important the retirees are, and that's looking at it from a statewide situation. So all I'm saying is there's lots of little chinks to be looked at, and nothing's too small, and don't be afraid of anything that's big either. That's my inspirational talk for the afternoon here.
And one thing I would like to mention, just in terms of the AROHE conference and talking about this past one, is the future. And the next one is going to be an in-person conference, we hope, if COVID behaves itself somewhat, at the University of Southern California is going to be the host. So it will be in LA. And one of the needs is going to be lots of people to help with the conference. So, you know, Gretchen this past year was a co-chair of the program committee, and Carol Pope, it turned out to be an immense resource in getting all sorts of videos done in preparation for the meeting and during the meeting and after the meeting. So there's lots of roles in finding sponsors and working on the program and in getting programs together and so forth. So I'd encourage anyone who is interested in thinking about that to volunteer. And if you want to send your name to me, I can send it on to the board, or however you want to get your name in. There's going to be a need for a lot of people, and it's already it's sort of crunch time already, because it's rather late to start planning a conference for next fall. So there's a lot of help that's going to be needed. So I'll just, in thinking about that conference, encourage people to do that.
Gray was very modest in not mentioning his role in technology for the AROHE conference. Thank you, Gray, for that.
Gray, is there any talk about, there's no talk about making this a hybrid conference, is it?
So there are some people talking about that, but nobody who is involved with the conference is wanting to go there. It turns out to be enormously expensive. And so there was a recent article, I think it was in the Chronicle of Higher Education, or that was talking about conferences and conferences of the future. And they quoted an organization that was estimating the cost for a hybrid, and that organization turned out to be the American Academy of Religion, which is one of the two main groups housed in the Luce Center. And they have a full-time person working on their conference, because it's a big deal conference. And they were saying that they estimated to do a hybrid conference would be an additional cost of $4.5 million. So it is a huge effort to try to do a hybrid conference, and partly because these conferences typically are housed in hotels and so forth. And when you start doing IT work and so forth, they want their own IT people involved, and it's enormously expensive. So the idea of a hybrid conference is out for next year just because of the logistics of doing it. Whether some of the sessions can be recorded and later done or not, I don't know. But yes, there has been some discussion of it. And privately, Sue Barnes told me, if anybody mentions that, be sure and tell them and speak up and say, no, that's not possible, because she did not want any part of doing that after realizing what it would be. So unfortunately, you know, I think everybody would say yes, hybrid, because it's so much less expensive and so much easier to go. It just turns out to be logistically from the other end very difficult and expensive to do.
Gray, let me suggest a way to overcome some of those logistical hurdles. And that's what the American Physical Society is doing for its big meetings. Their meeting is so big that they have half of the meeting in March and half of the meeting in April. In March, all the experimentalists report their results, and by April, the theoreticians are scrambling to explain them a month later. But I'm signed up for to give at the big April meeting, which is supposed to be held at a hotel on Times Square in New York in person. But they are also asking us to video our presentations and send the videos in, so that if need be, they can switch to being in video. And indeed, if you don't show up to give your talk, they will run your video. And I think that this can provide some of the means of giving a hybrid conference without the extraordinary expense that you raised.
Well, there's the issue of individual expenses too, right? How enormously expensive it is fly to a conference and pay for the hotel and et cetera, for the individuals. And it's very tempting, therefore, for individual attendees to choose the Zoom option instead of the in-person option. And that would certainly, throw a wrench into the works for the in-person conference.
Except that by doing it on Zoom, AROHE got twice as many attendees as he got in person.
That's true. And it was, by the way, Dorothy, 250, I think, attendees. That includes sponsors, but
I didn't count those, Gretchen.
Right. But I think the number of non-sponsors was still 230, something like that. It was well upwards.
Okay.
Of the usual. I mean, again, sort of twice.
Yeah.
Yeah.
Well, let me ask a question then, because one of the things that AROHE leadership always talked about was the fact that this conference was their fundraising conference, that this is the way they made money to do the things that they wanted to do. How much money did they make on this conference?
Ray, you want to report? We're rolling in money. The sponsorship committee did great work.
Yeah, it was actually the most money by far that we've ever made, primarily because of the sponsorships. The registration, it was only like $80 or $100 a person, whereas normally in an in-person conference is something like $300. So It wasn't the registration fees; it was the sponsorship, and part of the attraction for the sponsors was all of the publicity that they got in advance and during the meeting and so forth, which is different for an in-person conference because they're not going to be as many people there.
Right.
But I think a lot of people felt that although the Zoom conference was very good, I don't think we got any responses from people that said, oh, let's just do it virtually every year and not have any in-person conferences again. I think people missed that. So that's the difficulty that we face, and particularly as a small organization, that's part of the difficulty.
Alternate years, perhaps.
And Lewis has his hand up, I see.
Yeah, over the years, I've been involved in putting conferences together and participating in conferences. And one of the most important aspects of a conference, where you learn almost the most, is schmooze time. And it's schmooze time, not just between the sessions, but after the day is over. And I as a newbie, I kind of felt that was missing in a Zoom conference, that talking over a drink or a cup of coffee or whatever, getting to know each other in a very personal sense. When we put conferences together, we always had schmooze time. And so I think a face-to-face conference, actually, even if it's smaller, benefits the attendees far more than a Zoom conference, which might have more attendees, but you miss that human touch and that human interaction at the day's end or at the day's beginning or whatever.
Yeah, this is Gretchen again. I would think we'd all agree with that, Louis, but we did make some effort to provide the human touch, right? We had the speed networking. I don't know how many of you engaged in that. It's like speed dating, right? It was random. If you were signed up for such a thing, every 4 minutes, somebody else popped up on your screen that you got to visit with for 4 minutes. And then another 4 minutes and another 4 minutes. And of course, we did have the table discussions at 2 of the mornings of the conference. And again, Dennis got the Georgia Hero group together for one of those. But yeah, of course. And you couldn't drink together, could you?
No.
Well, I think it's time to move on. We are looking, the end of the meeting is approaching, and Mitch Clifton has very graciously come and attended our meeting, and is the current chair of the USG Retiree Council. Could you give us an update on that, Mitch?
I'm going to spend most of my time talking about the big topic that we had for our fall meeting of the USG, and which was the presentation of a report by a committee from AON. As many of you remember, in January 1st of 2016, the university transitioned to an individual post-65 medical retiree marketplace. So rather than all of us being required to take one plan, we had a choice of plans that we could get through the one USG website and call center. And that first year, we were allocated, each eligible retiree was allocated an individual HRA of $2,736, and that allocations remained constant up until the current year. And apparently sometime last year, the USG requested that the AON actuarial team assess the HRA purchasing power to help USG consider whether HR adjustments were going to be required in the future, adjust that dollar amount. And so an AON actuarial team got pulled together, and they examined a group of 14,182 eligible retirees that had both medical and pharmacy coverage as of January 1st, 2018, up through January 1st, 2021. So it covered a 3-year period. And so they were interested in what types of plans are members enrolled in, what are their overall costs, premiums plus out-of-pocket costs. And I'd like to read from a couple of tables in a report that was summarized to our retiree council at our meeting on October 8th, which gives some of the figures that they came up with. And one of the interesting tables was the, first I'm going to just consider the Medicare supplement or Medigap plans. And they found the distribution of choices among the Medigap plans were that of the 11,258 retirees that chose a Medigap plan, 81% were using Plan F, which is the richest and the most expensive premium of the plans. 11% were using Plan G, which they call an enhanced plan, which would have lower premiums on average than Plan F. And a further 7% were enrolled in Plan N, which would also have lower premiums than Plan G on average. And they noted that Plan F is no longer available for new retirees. Those who retire after 2019 do not have the option of choosing Plan F. And the distinction between Plan F and Plan G is G covers everything except 100% of Part B deductibles. And then Plan N covers everything that Plan G covers, except for Plan G covers 100% of Part B excess charges. So as a result, retirees that change from Plan F to one of these other plans, or who go into Plan G or into Plan N, will have lower average premiums per month than those in Plan F. And then I'd like to list some figures out of another table I presented, which compared those retirees who had chosen a Medicare Advantage plan as opposed to those which were in the Medigap plan, the ones I talked about before, plus a prescription drug plan going along with it. And so they mentioned that those choosing the Medigap plan plus the PDP were the 11,258 members that I mentioned before, and a much smaller number, 2,900, had chosen a Medicare Advantage plan. And then they listed the average annual premiums for those in the Medigap plus the PDP plan, and those were listed at an average of $2,888 per year. And for the Medicare Advantage plans, they're much lower. The premiums there only averaged about $349 per year. However, the estimated out-of-pocket expenses are higher for the Medicare Advantage plans at they estimated $1,849 per year, as opposed to the lower figure of the Medigap plans of $1,030 per year. And so they estimated total costs before applying the HRA for the Medigap plus the PDP at $3,918 per year, and those in the Medicare Advantage plan at a lower $2,196 in premiums per year. So then if you factor in the HRA allocation, they estimate that the average Medigap retiree have additional costs out of pocket of an additional $1,182 per year, while those in Medicare Advantage plan actually save some money in their HRA. They save on average $538 per year. So let me stop there and see if you have any comments or questions before I continue with their report.
Yeah, let me comment on that, because we had considerable discussion at the meeting. I think that Aon's report was in some ways very deceptive, because the purchasing power of the HRA has been going down with medical inflation. I presented some figures at the meeting, and what they were essentially arguing is that since retirees can choose less expensive plans, which of course are fine as long as they don't get sick and have the out-of-pocket expenses that they would then incur, they were really arguing that if somebody has been put on a starvation diet, that bread and water is cheaper than steak and potatoes, and therefore the decrease in the funding was actually an increase. And this is, I think, really, really deceptive. And I think that the USG Retiree Council is going to have to continue to work with the system office to make sure that retirees, in fact, do not have a plan. I suggested a cost of living adjustment that doesn't decrease with time. And that is what has happened to the HRA. One of the reasons that the university system converted to an HRA is that it was concerned about the future increases in cost of health benefits for retirees, and they essentially switched the burden of future expenses from the university system to the backs of retirees. And I think we're going to have to continue to grapple with this issue. Thank you.
And I would also note that the Aon Consulting Team conclusion is that the current HRA bought more in 2021 than it did in 2018. And the reason they came to the conclusion is they are factoring the 2,900 individuals that have chosen the much lower annual premiums of a Medicare Advantage plan. And many of these people probably are relatively healthy, and they've spent kind of fewer funds on the out-of-pocket expenses. They're probably also factoring that roughly 20% of individuals in Medicare supplement plans that have chosen the less expensive Plan G or Plan N plans as well. So that's probably why Aon was able to come to those conclusions. And the gist of this is that probably for the foreseeable future, the university is going to continue to limit our HRAs to that figure of $2,736. It's unlikely we're going to see an increase in this figure in the near future.
Lewis has his hand up.
Yeah. Mitch, I was on the state transition committee when going to Aon. And in that process, I raised the question. And the question was, how will you know what the actual out-of-pocket costs are beyond whatever HRA amount you set. And I never got an answer. And then at AROHE, almost as a sidebar in several sessions, some of the schools said that they had sent out a survey to retirees to find out exactly what was the real out-of-pocket expenses for each retiree. So my question is, does AON, does the Board of Regents, besides guesstimates, really know the dollar amount of out-of-pocket expenses for the retirees that can be then presented to whomever?
Louis, one of the things that Aon said is they can calculate the out-of-pocket expenses that are charged against the HRA, but they have no handle on the out-of-pocket expenses that retirees otherwise incur.
That's my point.
Yeah,
You
and
know,
that's what they said.
You know, for example, and I'll be very personal, my out-of-pocket expenses for this year beyond the HRA is approaches $6,000. There is no way Aon or the university knows that.
That's correct.
Let me say that the actuary which gave the presentation to us said that they had investigated this. And so I take her at her word that they attempted to do a good faith study on tracking what those actual costs are. However, the report given to us was just a very brief summary. We did not see the actual report that was prepared for the Board of Regents. So we are simply seeing summaries here. So we have no access to the data which led to these conclusions.
Well, my point is, how do they get the data if I don't submit the bills beyond 2736? There's no way they can know.
They don't get that data, Louis, and they said so.
What I remember is the actuarial person said they did not see the actual data. They used national estimates. So they weren't even interested in trying to track it at all.
Well, then can I make a suggestion? Am I off? Maybe Georgia Hero ought to see if we can develop some kind of survey to find out the actual figure and then present it to Aon and whomever.
Louis, that's probably better handled through the USG Retirees Council.
Whomever.
Yeah.
And let me finish up the last chart on this presentation to us that I found very interesting. Although I would like to, before I do that, I would like to make a comment that I know retirees of the USG who've chosen Medicare Advantage plans who are relatively healthy, who really do have very low out-of-pocket expenses during the year. So there are at least some which do have those lower expenses, plus they have the lower premiums. And so for them, a Medicare Advantage plan has been economically advantageous to them. But once again, those are people who are pretty healthy. And the other table I want to present to you was that they made a study of the HRA rollover balances as of December 31st, 2020. I found this very interesting. So among the Medigap plus PDP members, of which there were a total of 11,258, 40% of those members had rollover balances in their HRA at the end of the year, which means that 60% did not have a rollover balance, which means they had used up all the funds in their HRA by the end of the year. So 60% used up all their funds and 40% had a rollover balance. And of the members which had a rollover balance, the average was $1,436 at the end of the year. In contrast, those individuals which chose a Medicare Advantage plan, of which there were a total of 2,900, 81% of their members had a rollover balance at the end of the year. So only 19% had used up their entire balance. And of those that had a rollover balance at the end of the year, the average amount of the balance was $5,404. So that tells me that there's a significant number of Medicare Advantage members, retirees, who are having large balances in their HRA at the end of the year, as opposed to relatively small balances for those on the Medicare supplement or the Medigap plans. And I would suspect that many of those in the on the Medicare Advantage programs that have those large rollovers, they probably are not aware that they can have payments for their Part B and Part D deductions from their Social Security benefits. So I think we should be making a real effort to target those on the Medicare Advantage plans to make sure that they can be reimbursed for their Part B and Part D Medicare payments, because that would significantly reduce, I would guess that would significantly reduce the amount of rollovers in their balances at the end of the year.
And I agree very much with Mitch on that. The things that are eligible for reimbursement from the HRA are not just the premiums that one pays, but all the Part B and Part D that you pay through for Social Security, also the income-related medical adjustment, additional Social Security that one pays, and also all kinds of medical expenses, both prescription and non-prescription. All of that is eligible for reimbursement from the HRA, and we should be encouraging people to utilize their HRA as much as possible. Remind people that this is not, they're not saving this for their children and grandchildren. When they die, the HRA will revert to the university system. It's not something that they can inherit with. It dies with them. They have 6 months to spend it after death.
And Ted has had his hand up for some time.
I was just going to say that the University System of Georgia is not the only large employer that has made a move like this. The costs are actually shifted from the self-insured employer to Medicare, to CMS. And they save a lot of money. They save more than the HRA they give us. And their savings go up every year. On the other hand, our HRA is the most generous one that I know of. I think Emory provides an HRA, don't they?
Yes and no. I say yes and no because they do for those who began employment before, I think, January 1st of 2003. For those who begin employment after that, they don't. And so there is an HRA for those who began employment before then and then retired.
Mm-hmm. And I think it could very easily become a political thing if it gets out. How generous the HRA is provided. And we know what most of the politicians in Georgia think of college professors. So I think it's very unlikely that the HRA will be raised. I think it's much more likely that it will be cut. And that was all I wanted to say.
And let me say one last thing about this report. This report is marked proprietary and confidential. So we are still working with Karen Elliott to see how much of this report we can release to as part of our minutes for the fall meeting of the Retiree Council. So if we're able to reduce release all 8 pages of these slides, we will do so. It's possible we may be only able to reduce kind of a summary of this report. So in any case, I've given you some of the figures off of it today, and we will continue to work to see if we can reduce the full summary of this report to you. Any other questions for me?
Thank you very much, Mitch. It's a big topic of conversation.
Well, if I could, let me say one final thing. We did have a number of committee reports presented to us, and these were pretty much mundane. I will say that our library committee and our task force on Merit policy are continuing to work to kind of equalize the application of merit status across the university system, and library usage across the university system is going on. There's not much to report, not much progress to report this year, but our committees are continuing to work to address these problems. And with that, I'm done.
Well, thank you very much. And I would like to thank everyone who's stuck with us until the end here. Are there any more comments? Or I'm very pleased to see everyone. And over the years, I think I've gotten to know almost all of you. So I recognize you, and I'm glad that you were here today. And Dave, we wish you very well, and good luck with setting things up and getting your life back together. And we hope to see you again soon.
Thanks very much. I'm very impressed with the meeting that you have all put together, and I appreciate it and thank you.
Okay, well, everybody say goodbye.
Bye, Ted. I'm proud of you.
Bye-bye. Thank you.